For this test, I'm going to be performing the internal rotation of the tibia mobilization with movement in a closed chain position. You can use this technique for somebody with patellofemoral pain syndrome, somebody who has pain with flexion of the knee, or limited range of motion with pain of flexion. What you can have your patient do is place the affected limb on a chair, or if you have a table that goes low enough, up on the table, and I have her holding on to the back of the chair for support, just to keep her balance if she loses her balance. So what we're going to do is I'm going to internally rotate the tibia as she lunges forward to try to help create space and help relieve some of that pain in the knee. So we'll do is I'm going to feel for the two tibial tuberosities, and I'm going to grip the back of her leg, and what I'm going to do is I'm going to internally rotate her tibia, and then I'll have her lunge forward until she can. Good. And back. And lunge forward. So this should be a pretty rhythmic movement, just continual internal rotation of her tibia. And this should be pain-free while she's doing it. You don't want her to have any pain. And hopefully this can help to not only decrease her pain with this movement, but also increase range of motion. And relax. This next test we're going to perform is the Lachman's test. You perform this test in conjunction with multiple other tests to test for an ACL tear or sprain. So you have your patient supine on the table. And then what you have her do is you'll have her bend her knee to about 20 to 25 degrees. And then what I will do is I will come and just kind of place my weight on her foot to help stabilize that lower leg for the movement. So what you'll do is you will feel for her tibial tuberosities, and then you can place one hand just below or above the femoral condyles, and I'm just going to slightly pull anteriorly on her tibia. And what I'm looking for is an anterior translation or a softened feel of the tibia with this movement, which would indicate a ACL tear or sprain. If you need to bring both hands down, you can, and just feel for those tuberosities again and just pull forward. And again, you're just looking for that anterior translation. This next test we are performing is called the Tinel sign. So this is a special test we perform if we suspected tarsal tunnel syndrome, which is compression of the posterior tibial nerve as it runs behind the medial malleolus. So what you would do is have your patient side lying comfortably on the table, so you can expose and have access to that medial part of the foot. So what you will do is you will find that medial malleolus, and then what you're going to do is just lightly tap on the posterior medial aspect of the foot, and as you do that, you're having your patient tell you whether or not there's any reproduction of symptoms, which would be numbness and tingling on the plantar aspect of the foot. So as you do that, you have your patient tell you whether or not she has these symptoms, and if so, tarsal tunnel. If not, you can move on to some other tests if you're looking for plantar fasciitis or cuboid syndrome. This is a way to either rule out those or rule in tarsal tunnel syndrome. This next test is the AP glide of the MTP joints. So we would do this test to help with any dysfunction or lack of range of motion in the toes at the MTP joint. So what you do is you have your patient lying prone on the table. You'll have her bend her knee up to about 90 degrees so you can have access to the toes. So what you'll do is you will grip with one hand and stabilize with this thumb at the first ray of the MTP right along that MTP joint, and then you take your other hand and do the same. Grip that toe, that full toe in your hand, and have your thumb right above that MTP joint line. And we're doing an AP glide, so that is an anterior to posterior glide. So we're going to go move anterior to posterior. And this will be helping if our patient has any dysfunction or pain in that joint or any limitations in dorsiflexion of the toe. You could also do the other toes. Same thing, you just grip the toe, find the joint, the ray of the joint, and just move anterior to posterior. If your patient cannot stand or has issues with going prone on the table, you could have them supine with their feet hanging off a little bit so you can still have access to those toes, or you could have them sitting on the edge of the table and you could get down on your knee or in a little chair and work from there, just whatever's most comfortable for your patient.